Hello, this is Dr. Lewerenz of Longevity Health Institute. I hope you're well, and I hope this enlightens you and might make you even a little better, or at least to share with someone else that you know or love. So I had an interesting case today, something that's a little bit outside the box, a little esoteric, but something that we see occasionally, something that's very real, something that is an epidemic in our country, underappreciated, and it really can affect you neurologically and cardiovascular wise, and that is heavy metals. Now, I'm here in my laboratory where we look at cytology on the microscope, and we can tell sometimes when people have heavy metals, and we always follow that up with blood and urine analysis. 24-hour urine analysis are, I feel, the best to really check heavy metals, but it's not if you're toxic, it's often how toxic are you. Lead, mercury, cadmium, arsenic, very common things. Gadolinium, many things that we see all the time. And it's about the load. So, our body can accumulate and deal with toxins and has a liver and all that can methylate and get rid of these things, yet these do bioaccumulate. The case today was very interesting because I have a patient that actually was in a dental chair, was having a tooth extraction and work done on a couple of her molars, and had to have a post put in, and she believes it was either titanium or steel. And she actually had something that we called a Herxheimer reaction, which is she had this big, essentially like almost allergic, if you will, anaphylactic. Her muscles got tight, got catatonic-like, passed out. Actually had to go 911 to the ER. They did a full workup on her, and she's doing fine now, but is like, what the heck happened? She had to stop the procedure, and she's really dumbfounded, never had issues or anything like this. Now, my assumption is, and we're testing her, she came in today urgently, my assumption is that she's carrying a pretty significant heavy metal, probably mercury, tin, lead, aluminum levels, because of all of the fillings, all the amalgam fillings in her mouth, and that they were doing some extractions and some work in her mouth, and that's releasing more mercury or heavy metal. And these can neurologically, and including cardiovascularly, have profound effects on your body, and it's all about the load. So I suspect in her it's going to be very high, and in a stressful environment, stressful situation, probably some adrenal stress at the time going on. She's in a dental chair. She said it was a little bit painful. She could smell like bone and smell some erosions of things that they were using with drilling. Pretty traumatic, although stuff I know that needs to be done. But if it's releasing these toxins, releasing heavy metals into the system, you can actually have a pretty immediate response into something that appeared to be neurologic, and really affected her to the extent of getting her into the ER. So what will we do? Well, we're actually checking her, making sure her levels are appropriate. And if they are, we'll probably have to look at her adrenals. Did she have a syncopal or passing out episode due to low blood pressure and stress and anxiety and stuff into the dental chair? That's always a possibility. But we want to rule out the bad stuff first. And she literally got catatonic and passed out, had muscle contracture. The dentist was floored, had never had an experience like that. So it'll be a very interesting case. But we do carry heavy metals in our body, and again in the mouth, and these can have neurodegenerative and cardiovascular effects, and sometimes something so drastic as that. So get your heavy metals tested. Make sure you don't have high mercury. Make sure you don't have high lead, tin, gadolinium. That's done in dyes and contrast in the hospital all the time, because long term you're talking about affecting your cardiovascular system, your brain, your nervous system, so things like paresthesias, numbness, tingling, memory over time, heart disease, vascular disease. These are all big risks when you have that and have that kind of burden. You can get it out of you. We have protocols here we do all the time with patients, sometimes orally, sometimes digestively, also IV chelation, things that get these out of you very effectively, very safe. But it's something to be aware of, something to look into, enlighten others about, and I hope this informs you well, and especially if you're going to a dentist and having some dental work or having some fillings removed or exchanged or what have you, because you got to consider these things. So This is Dr. Lewerenz, Longevity Health Institute. You know, we're always here to improve your health, make you well, make you healthy, thrive, not just survive. So look us up on the internet, follow us on Facebook, on Instagram. You can always reach us here at the offices, 248-289-6643. We do the best in functional and personalized medicine. And I think what's really key always is we always look at the details. You need details. You're worth it. So be well. This is Dr. Lewerenz.